Hey, welcome to my stroke video. Today we're going to learn all we can about stroke in 6 minutes. Starting off, stroke is a sudden interruption of cerebral blood flow with deficits at least 24 hours. We have anoxia that starts out with lack of oxygen, go to infarction, so some cell death and other things going on there, with some post-cerebral vascular accident edema causing even more damage. What kind of strokes are we going to have? We're going to have ischemic, we're going to have thrombus or embolism, we have hemorrhagic, so that could be aneurysm, trauma, arteriovenous malformation, so we're looking at those things. Other smaller things we're going to look at, not specifically to ischemic or hemorrhagic, is lacunar, which is in the deep white matter with some small arteries, and then transient ischemic attack, which is mini stroke with less than an hour of symptoms. Moving on to some of the basics. So we're going to go with left and rights, which I still can't get right. Left, we're going to have right side hemiplegia with some cognitive and behavioral deficits. So this really categorizes it. We have negative, anxious, slow, cautious, hesitant, preservation. Really think about those with these left side strokes. Also, disruption of speech and language is really important to think here. So you might want to communicate with nonverbal using small steps because it's hard to generalize info for them. Right side strokes. So we have left side hemiplegia, opposite of course, but then we have left side neglect. Very important to think here because we're going to have spatial relationship issues, attention, body image, agnosia, so not recognizing objects like this and people. Impulsive and quick. We want to be really careful with here because they're going to have poor judgment and safety. And they're going to overestimate their abilities, so we want to use verbal instructions, frequent feedback, making sure they're safe. Moving on to the different types of arteries. So what do we have here? We have anterior cerebral artery. It's going to be more than 2/3 right here. Look at the cross section right here. So we got this little inside area. So we're looking at frontal lobe, parietal lobe, basal ganglia, corpus callosum, internal capsule. But what are we going to think of deficits? Well, we have contralateral sensory loss and hemiparesis. We're going to think of low extremities more so. Take this right here, translate to homunculus. Homunculus is right here. Say hi, what's up? Think about right here. So it's a little flipped image. We got that lower extremity. Now, going down some more symptoms, we can have expressive aphasia, gait apraxia, personality behavior issues. Middle cerebral, as you can see, the cross section is more of this outer area. Going over the homunculus again, we're going to think face and arm right here. Sensory is going to be very similar with the big lips, as you can see, but we have that lateral aspect with this middle cerebral artery, and it's the most common stroke. We have this contralateral sensory and hemiparesis again, but speech dysfunction with left and then right side has neglect. Sensory ataxia is another thing to look at, but that's middle cerebral. And then posterior, we're just going to name the areas here. Just think about deficits that happen. Occipital, temporal, thalamic lobe, and some other ones, but we have that cross section as well. Just to touch on some smaller areas, well, not smaller, but they're still really significant. Just want to touch on ICA, PICA. So ICA could have a lot of peripheral nerve involvement. Think about where it is. Unilateral deafness, lateral gaze palsy, Horner's, other stuff. But PICA, we just really want to think about Wallenberg syndrome. Then vertebral, we just want to mention how it supplies the cerebellum and medulla. Basal, we got lots of things here. So pons, internal ear, cerebellum, PCA, and think about cranial nerves here. That's the main thing for symptoms. I want to think about cranial nerve involvement. So that could be cranial nerves 3, 4, and 6, dysconjugate gaze, Horner syndrome, nystagmus, vertigo, etc. Pure cellular though, we got some severe ataxia, dysarthria, dysmetria, contralateral pain and temperature loss. Just to really wrap this and tie a bow on here, we have PT. So PT, let's advocate real quick. Very important for strokes. Early rehab has been shown to have in the first 3 to 30 days really improved stuff. So we got improvements of motor function, ambulation, and mobility. We also have increase in the modified Rankin scale, on lower extremities, and first 24 to 48 hours has shown increase in lower extremity function within the first week. Very quick turnaround there. And then we wanted to really incorporate frequent but short sessions. Very important. So that is what we need to know about strokes, my friends. Good luck.